One Midwest startup is doing its part to help fill the gap when it comes to hand sanitizer. Cosmetics startup Garb2Art was founded in 2013 and has become known for its lip gloss and bath bombs. But when requests started coming in for hand sanitizer, its founder spent $20,000 to pivot production, scale up hiring, and it is now on track in the first quarter to surpass all of its sales for the entire 2019 calendar year. Joining me now via Skype from Columbus, Indiana, is the cancer-surviving GED holding mother of five, founder and CEO of Garb2Art, Dawn Andrews. Dawn, good morning. Thank you for being here with us. So we kind of gave a quick intro there, but if you could just elaborate a little bit more on how and why you decided to pivot. Did someone contact you? Did you decide, hey, I can contribute to the growing need here?
Yes, it was really a little bit of both. We do have sales reps that sell for Garb2Art across the United States, and clearly New York, California were hit faster, harder, and we had a lot of calls from those areas asking if we could produce hand sanitizer. It's something that we had done years ago that's not normally something we do now, and of course I'm just the type of person, if I know that there's a need, we certainly try to make that happen, and that's exactly how it happened. And it was immediate. As soon as we had it, overnight sales were crazy.
How quickly could you pivot your production lines from making the bath products to making hand sanitizer?
Getting people in place wasn't so much the hard part. Is I'm sure everyone is aware. It's getting alcohol. I think there's this misconception right now that the world is out of alcohol. That's not necessarily the case. Manufacturers are still making that, but it's extremely hard to get. It's a lot more expensive, and you can't get it the next day. So I think the biggest issue was making sure we had that, and then components. Bottle components are extremely high demand as well right now because so many people are trying to make sanitizers and other products that are needed. So it took us almost a week just to get the products to make this when we already had a backup on the orders.
So you mentioned that you had to ramp up hiring. How many people did you hire? Where did you get them? Where did they come from? What were they doing before?
We probably have, so a lot of them are off-site, clearly, because we have to make sure that we don't have too many people together at once. But locally, we're hit extremely hard with servers and bartenders who have lost every bit of their income. So it was a really good opportunity for me to bring some people in who had nothing coming in at all. They have families, they have bills to pay. And so that's where we're getting our workers right now. And it's really fulfilling to be able to help that need as well.
And so who are your clients right now? Is it mainly hospitals or medical centers?
It's really across the board, both of those, yes. There are a lot of jails that we're providing to. Pharmacies have skyrocketed in the last few days because clearly pharmacies are staying open. But those are a majority of what we have. Some online boutiques, clearly people who are still selling that way are trying to help their customers as well. But mostly medical field for sure.
I hope that others will sort of learn the lesson that you've set forward here. Do you have advice if there are other manufacturers, entrepreneurs, or even large companies out there that may have the capacity to pivot production and start producing items that are most in need right now? What would you tell them? What's your advice? Who do they contact? How do they do it?
I think my main advice is whatever you can do to help. Clearly, we normally do make lip gloss. These are not normal times and situations. Think outside of the box. What can you do? And there are so many times, too, that people will say, you can't do this, you can't get that. Just ask. Start calling people. Find out who suppliers are. Clearly, there are certain regulations that you have to go through to make these things happen. But if you get a team together and set your mind to it, you can definitely make it happen, especially right now when there's such an important need to just help each other.
This is fabulous, absolutely fabulous. You mentioned previously there about the employees needing to ramp up the number of employees, but also having to put them off-site for the spacing. Where are they if they're off-site? Are they actually producing at another facility, or are they just potentially bottling and labeling somewhere else?
Well, so oddly enough, we have a couple of women who are pregnant, and clearly I don't even want them out of their house at this point in time. So they are off-site labeling. We have some people doing some QuickBooks invoicing and billing offsite. Anything that does not have to be done here, the bottling, the mixing, all of that has to be done here. Shipping labels can be done offsite, but again, you've just got to be really creative and figure out how you can take as many people and help them as far as income, and then get the products out to help other people as well.